All, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. In this video, my mentees are going to discuss about a case which is a very interesting case in carpal tunnel syndrome. So in which they are going to present how they assessed the case and what are the features they saw during their assessment and how they treated with the proper physiotherapy management and what were the outcome measures used in that. So they are going to describe that in detail. So let's begin with the details of the patient. Yes, what is the patient details?
The patient is about 42 years of female office worker. Chief complaints, pain in the wrist for 6 months in the right hand, numbness and tingling in the thumb, index finger and the middle finger and the radial half of the ring finger. Symptoms worse during the night. Difficulty in typing and holding the object for prolonged period. Reduced grip strength. History of present illness. The patient report gradual onset of symptoms with no history of trauma. She works on a computer for approximately 8 hours daily and perform repetitive wrist movements. Symptoms initially occurred only during the work but gradually progressed to include nighttime pain and the hand weakness. Relevant medical history: no diabetes, no rheumatoid arthritis, no previous wrist fracture or no neurological disorders. Functional limitations: the patient report difficulty with writing for long period, typing and holding for a mobile phone, opening jars and carrying a glossary bag.
Yes, so the patient is typically non-medical condition, non-surgical history patient, and she is not having any underlying pathologies like diabetes or hypertension. Typically, she developed symptoms only in the right hand. So what is the next? How you subjectively assess the case?
So the subjective assessment comes like the pain intensity was measured using a numeric pain rating scale. So which shows that the patient has 3 intensity out of 10 during a rest, and during activity it was about 7. So the patient described pain as burning sensation, tingling sensation and also felt numbness. So the next was the observation. During inspection, there was no visible swelling. There was a mild wasting of thin arm muscles and protective position of wrist was accommodated. So the next is palpation. In palpation, it was found that there was a tenderness which is in the vulvar aspect of the wrist. So the next was range of motion. So in wrist, the range of motion for flexion was about 70 degree, extension was 65 degree, then radial deviation was 20 degree and ulnar deviation was 30 degree. So the movement was associated with a mild discomfort. So the next comes muscle testing. So muscle strength testing can be done using a grit method, which is used to identify by dynamo manometer. In right hand it was about 7 kg and left hand it was about 28 kg. So next was manual muscle testing. So the manual muscle testing showed that thenar muscle was about 4 out of 5. Then the wrist flexors and extensors was about 5 to 5. So the next is sensory examination. So there was a reduced sensation over the thumb, index and middle finger and lateral half of the ring finger.
Yeah, okay. So what are the special tests you have done to confirm the condition?
Now let's see the special test for carpal tunnel syndrome. Firstly, phalanx test. The patient is maintained maximal wrist flexion for 60 seconds. Tingling sensation reproduced within 25 seconds. So the result is positive. Next, tunnel sign. Tapping over the carpal tunnel produced paresthesia along the median node distribution. The result is positive. Carpal compression test. Direct compression over the carpal tunnel reproduced symptoms and the result is positive.
So these phalanx test, tunnel sign and the carpal tunnel compression test, all these belongs to a nerve related test. So those tests were positive. So finally we concluded this as a carpal tunnel syndrome. So what will be the next sensory symptoms or assessment what you saw? Yes, Malati. Measures you saw.
Outcome measures: Boston Carpal Tunnel Questionnaire. Baseline scores: Symptom Severity Scales 3.655, Functional Status Scales 3.257, Grip Strength 18 kg on affected side. Physiotherapy assessment summary. Key impairment identified. Pain, paresthesia, reduced grip strength, maintain medial nerve irritations, functional limitation during work activities, mild thinner muscle weakness.
So all these came to an understanding of there is a typical carpal tunnel syndrome for the patient. So you all saw the patient. So what management you framed and what are the exercises you included in that?
In PT management, first we prescribe wrist splinting for the neutral position of the wrist for during sleeping and aggravating factors. For benefit for the splinting, maintain the optimal tunnel space and reduce the nerve compression. And we reduce the pain management by cryotherapy and acute condition. The duration for the cryotherapy 10 to 15 minutes applied once a day. Medial nerve gliding exercise. In this exercise, where the patient position is kept at wrist neutral position, finger extension, wrist extension, forearm supination and gentle thumb extension. The dosage can repeat at 10 repetition, 3 sets per day. And tendon gliding exercise. Position of the patient will be straight hand, hook fist, full fist and straight fist. The dosage for the tendon gliding exercise 10 repetition, 3 sets per day. The benefits for the tendon gliding exercise: improving the tendon extension, reduce balance pressure, and stretching exercise. We improve the flexors and the extensions of the wrist muscles. The repetition for the we can hold 50 seconds and repeat 3 to 5 times a day. Strengthening exercise for the carpal tunnel syndrome. There are the therapy, fruity exercise, hand gripper exercise, and rubber band finger extension. The frequency for 3 sets of 10 per day.
Then what are the other exercises? Only name the exercises.
And
Name the exercises. What are the exercises? Finger gliding exercise.
there are the median nerve gliding
Median nerve
exercise
gliding
and
exercise.
tendon nerve gliding exercise.
Exercise.
Tendon gliding exercise and stretching exercise for removing improving the muscle range of motion and
And
strengthening
strength.
exercise for weakened muscle.
Okay. So what do you want to conclude in this?
Okay, case studies demonstrate that conservative physical management can effectively improve movements and symptoms and functional performance in patients with mild to moderate carpal tunnel syndrome. Early interventions, patient education, splinting, nerve blading exercises, tendon exercises, and ergonomic corrections are all contribute to successful rehabilitation. Finally, we conclude this case study with carpal tunnel syndrome is the most common peripheral nerve entrapment disorder. This is accurate assessment is essential for diagnosis. Physiotherapy plays a major role in conservative management. Thank you.
Yes. So I enjoyed your presentation. It was a very good presentation. Hope you all enjoyed this presentation. I'll catch you in some other video. Thank you.